Hello, everyone. I'm Brittany Hume, and I'm the Vice President of Strategic Partnerships at the Health Initiative, or THI. THI is focused on increasing health equity in the U.S. by shifting the conversation and the country's substantial investments from healthcare to health, emphasizing the role that drivers of health like food, housing, and wages play in people's ability to be healthy. In my role, I lead our engagement with government and corporate partners. I'm brand new at THI, charting my way through my first 100 days and adjusting my experiences in health access and equity from a global context to the US. I'm also on the eve of moving across the country from San Francisco to Boston, hence the shout out in the background to my home here. As you may be starting to gather, the name of the game for me during WomenLift Health was transitions. My leadership project is a little different than others. Initially, it was fully in scope of my old organization and role, but as I steered through the turns of the last year and formally changed my project several times along the way, it finally became clear to me that my real leadership project ended up being myself and my career path. In the early summer of 2020, during the accidental summer session that WomenLift pulled together when COVID delayed our original start, our facilitator showed us this visual when speaking to us about leading through a crisis. At the time, it hit home for me in a visceral way because I could spot myself and so many others around me sliding in a free fall down the left side of the graph. When WomenLift started, I was leading a global team at a global health startup I loved. When COVID hit, my direct reports went from living on airplanes to living in lockdown, many alone, in apartments around the world. My team, my company, my family, my country, and the world all felt unstable and vulnerable. Unrest related to systemic racism and the murder of George Floyd, wildfires in my home of California, and ultimately a strategy shift and round of layoffs at my company threw everything further into chaos. I finally made the difficult decision to leave the company, and our family relocated to be closer to family for a few months to escape the smoke and support each other through an unprecedented time. I look back now and see how prescient this visual was. I will review quickly how WomenLift Health lent me the wisdom, tools, and support to climb out of the valley of chaos and lift it off on the other side. First, WomenLift gave me the lenses to evaluate my situation objectively and put it in context. Early on in the program, they taught us that the world was VUCA, volatile, uncertain, complex, and ambiguous, and perhaps never more so than right then during COVID. It's no wonder I was feeling stressed. I could also ask whether my recent frustrations were born out of my own shortcomings or the circumstances I was in. Thanks to a 360 assessment, I was able to take stock of my strengths and shortcomings from my colleagues' points of view in a way that I could internalize them. WomenLift also helped me see that I probably didn't have the resources I needed in my role to be successful, even regardless of COVID. All of these insights helped give me the confidence to know that I could take a leap and explore what could be next for me after taking some time for family. I was able to identify and apply tools to gain my footing and move forward. WomenLift helped me see that as an extrovert, one of the key practices I'd relied on for resilience pre-COVID, social connections, was no longer available to me. Instead, there were other ways that I could and should be recharging, like sleeping or savoring a good meal. During one of the hardest stretches, WomenLift asked us to keep short daily journals to identify patterns in our internal conversations. Once it was on paper, I saw that I was harder on myself than I would ever be on anyone else, and that level of self-criticism was unhealthy. Similarly, it was helpful to hear guest speakers to WomenLift share that they too could be too hard on themselves, despite everything they had accomplished. I wasn't the only one who sometimes needed a reminder to show myself some grace. Once I was ready, I began to plan what was next. And I started with my values. What motivations had inspired my years spent in global health? And were those beliefs and values exclusive of the US? WomenLift also helped us see that change isn't all bad and neither are risks. I was nudged to look beyond the most proximate opportunities and think about the risks that I needed to take to advance my career. Third, I was able to confidently understand and play to my strengths during the interview process, thanks to the many assessments WomenLift asked us to complete along the way. And finally, working with the coach that WomenLift provided, I was able to recognize aspects of a job that were critical to my satisfaction and sustained effort. This helped explain why my previous one had suddenly gone from hard driving but sustainable to untenable when one of the legs of that stool had come loose, and what I needed to screen for as I interviewed for new roles. Once I decided to join the health initiative, WomenLift's lessons helped me lead with intention from the start. I mapped out a 100-day plan that laid out the outcomes and culture I wanted to achieve across all threads of my role, like growing a diverse and empowered team and fostering a more scalable approach to partnerships. Then, after immersing myself to understand how the organization worked today and how stakeholders respond to change, I began following WomenLift's advice for how to lead change, including thinking about change as a bicycle with two tires moving forward in sync, one to change people dynamics and one to change processes, moving at the same pace and in the same direction. I'm still in the midst of these first 100 days, and I know it will be an ongoing process, but I am glad to have had those tools so readily at hand from the start. As I look back on this truly crazy 18-month period, I feel grateful and relieved to have made it through to the other side, particularly as I know that so many others around the world have had it far worse. The multifaceted support of WomenLift, from the lessons to the spot-on advice from my peers and my coach, to the power of the network in my job search, turned out to be the stepstones I needed before I even knew I would need them. Thank you for this rich and rewarding experience.